at 11. And so I think even though we may have people continuing to join on and come into the room, I thought I would go ahead and start my intro because the person you're really here to hear is Jason Gilliland, who I had the pleasure to meet at a conference this summer, which people started referring to as summer camp for scientists. So we got together across disciplines and talked about ways to use digital observation of human behavior for good. And I was really excited to hear some of the insights from his perspective. We were involved in groups around geography and social environment. So that is how I come to be the host and inviting and introducing Jason today. So Jason, among his several titles, and I know his bio is distributed, is director of the Human Environment and Analysis Laboratory. And the projects that they have, which I thought had a lot of overlap with interest at the Urban Health Collaborative, include topics around food, both food environment, but also food waste, around physical activity, and especially child-focused physical activity work, around things that we breathe in, whether that's air pollution or vaping, and some topics, of course, around COVID-19. So I wanted, in addition to that breadth of topics, to highlight some of the products that are coming out of his group, which have opportunities for lessons and crosstalk with our own work here at Drexel School of Public Health, which include a set of systematic reviews, as well as work that takes on either quantitative or mixed methods approaches. I was especially excited to see some of the work on child activity spaces that use that mixed method approach. But beyond publishing to a peer review audience, there are also podcasts, and one of the recent podcasts was on effective community engaged research practices. So knowing that those interests overlap with ours, I'm just so excited to have him here to speak with us today. So I think we can see on the slide that he's from Western University, and to orient where London in the province of Ontario is, it's basically between Toronto and Detroit. And the last thing I want to say is that he's gotten a couple of recognitions that just highlight the contributions he's making to the field, including in 2020, a Scientist of the Year award from the Children's Health Foundation, and then in 2022, an award for scholarly distinction from the Canadian Association of Geographers. So with that, help me welcome Jason Gilliland.
Thank you very much, Gina, for that introduction. I want to thank you for the invitation, and thank you, Gianna, for making my itinerary so exciting and getting me here safely, and all of you for welcoming me. I had a wonderful conversation this morning with the West Philly Promise Neighborhood Group, and I look forward to hearing more about that. So really, let's see, this will advance. What I'm going to talk to you today about, if I can advance the slides, yes, is about collaborating for community health. And I'm going to give you really, over the next 40 minutes or so, I want to share some of the experiences that I've had, maybe my academic journey so far over the last 2 decades. And the talk is broken up into 3 parts. I'm going to first talk about my particular approach to what I call community geography. And then I'm going to discuss 3 case studies of collaboration for community health, specifically children's health. And finally, I'm going to discuss some of my lessons learned over the past 2 decades about community university collaborations. But first, I'm sure some of you are wondering, what is community geography? And I wouldn't blame you if some of you had in your mind this picture of students wandering around a neighborhood with a map pointing out interesting places. And as a geographer, yeah, we kind of do that. We love maps and we love field work, but it's much more than that. First and foremost, community geography is collaborative and participatory. And yes, I'll tell you, all of the photos that you'll see here were taken before the pandemic, back when we could get professional haircuts and we could congregate closely together. So actually, this photo is of me and the former head of the roads department of my city of London, London, Ontario, Canada, the 2nd largest London in the world. We're working with a class of elementary students, looking at the barriers, supports and barriers to health in their neighborhood. For lack of a better definition at the time, I know now community geography is a field and has their own definitions. I came up with my own. And to me, community geography is research involving collaboration and the participation of those of a place or an area affected by an issue for the purposes of education and action towards affecting positive social, economic, and environmental change. So the key thing there, the key points are, it's research, it's collaborative, it's participatory, education, and action. And yes, I know some of you are thinking to yourself, isn't that just community-based participatory action research with a geography slant? Yes, it is. So why have I adopted a participatory and collaborative approach? First, I think there's really been a mutual frustration with traditional research approach. So as researchers, we get frustrated because we often don't know if anything happens with all the work we do. Sure, we can see citations from other academics, but we don't know what happens to our work after it hits the shelf. And of course, community members get frustrated because they often serve as research subjects without ever learning what the researchers did with that data, right? What did they do with that information, and whether it actually ever had a positive change in the community. I often talk about that as smash and grab research. Community researchers go in there, grab some community data, and then take off. So therefore, a collaborative approach is a participatory approach really helps us ensure that our research has integrity, relevance, and the greatest potential for positive impact. And third, the complexity of today's problems is really too big for one single outside expert. Right? We think about problems such as childhood obesity, or climate change, or the pandemic, the so-called wicked problems. They really need a collaborative and multidisciplinary approach. Start the timer there. So to ensure my research is more meaningful, in 2004, about a year after I got my first professor job, I established an interdisciplinary research and training environment called the Human Environments Analysis Lab, or HEAL for short. And I would say there was really two events that, to me, I was hired as an urban development guy, urban historical geographer at the time, but two events really have pushed me in this direction. First, I arrived there and I noticed a bias in the neighborhood, bias in the newspapers about a certain neighborhood on the east end of our city, our old East Village. So I reached out to the head of the business improvement area, a wonderful community organizer named Sarah Merritt, and I asked her to come speak to my class. And next thing you know, I was a member of the board, the BIA board member, and I've been really doing community engaged learning ever since in my class. I was really inspired. And second, I think the other inspiration for me was I adopted a baby girl, and I became a parent for the first time, and this made me see the world differently. It made me realize that cities are really not designed for children, with children and youth, and it really focused my work on to children's environments. I still study other people too, but a lot of my work is focused on children's environments. And how cities are basically offer supports, but also barriers to well-being. So these two experiences helped me form, and many others, many other experiences helped me develop this mission statement for the lab. Is to develop and connect highly skilled researchers to create, disseminate, and mobilize knowledge for making healthy and thriving communities. And so our specialties include child health, of course, but also community-based research, geographic information science, integrated knowledge translation, community engaged learning, and lots of other things that I didn't have an acronym for. And since 2004, we've had many collaborators. Over 20 faculty associates have joined us from universities, from Western and other universities around the world. Over 200 community collaborators from nonprofits, charities, municipal government, et cetera. Over 1,000 student trainees we've had in the last 20 years, some from classes, but most of these, over 800, have been paid as research assistants to work with us in the lab. Another important development, so in addition to undergrads, grads, and postdocs, we've also had dozens of teens work in the lab. Some were high school co-op students, so they do their internships with us. And then some of them have become members of our Youth Advisory Council, or our YAC. And so we established this in 2018, co-led by my postdoc at the time, Stephanie Cohen, who's now a prof at Nottingham in geography. And we had 3 amazing high school students at that time, Suraj, Krishna, and Ahad. And so they helped us develop the terms for this new Youth Advisory Council. So the YAC is made up of a diverse and impressive group of teams from high schools all around the region. That collage at the bottom there shows our membership from 2020, 2021. So the purpose of the HEAL-YAC is to integrate youth voices into, and there's perspectives into our research on young people's health and well-being. We wanted to get their experiences to help guide us. So as part of the operational structure of the lab, the HEAL-YAC is how we implement an overarching participatory approach that sees research as with and for youth, not just on youth. And by establishing this YAC, we position youth input as integral to both shaping both the wider strategic directions and priorities of the lab, but also decision-making for certain projects. So in addition to advising us on various HEAL research projects and completing numerous pedagogical activities, so we do a lot of training with them on qualitative methods, et cetera. Some of the activities the HEAL-YAC's been involved with over the years, we published a journal article in 2018. We had a YAC Youth Advisory Conference of Youth Advisory Councils, and a lot of youth vaping awareness, position statements on key issues of importance to them. We published a book chapter. We also have an ongoing CIHR grant called Quarantining, looking at the experiences of youth and teens during COVID. And so the teens on that project have helped us they conduct the focus groups and train them on focus group methodology, et cetera. And we've had a couple actually major grants with the teens. So now that I've given you a little bit about the perspective, I want to focus on a few case studies, just 3 quick case studies of community collaborations. So first, I want to talk about physical activity. That's one area that we've done a lot of research in, and probably like the US, in Canada, only 15% of 5 to 17-year-olds are meeting physical activity guidelines for optimal growth and development. And so we've done a lot of cross-sectional research on and others on physical activity in children and youth. We've learned from that PA declines with age, especially around grade 5, ages 9 to 11. For the built environment people here, accessibility to parks and recreation spaces near home is a significant predictor of increased physical activity and lower BMIs, body mass index. And so from all this early research that we did, we recognized the need, and that's the needed interventions to remove barriers to active outdoor play and organized sport and recreation programs. So with that knowledge, our solution to the problem of physical inactivity was the ActiPass program. And so the ActiPass is a free recreational access pass that provides all grade 5 children in London, Ontario, access to extensive physical activity programming through multiple service providers. So the program was actually we designed this to capitalize on underutilized capacity in recreation programs that were offered by our community partners. So there were already lots of activities going on with empty spaces. So the goal was to remove financial barriers and increase accessibility to physical activity opportunities during a pivotal time in child's development, around that ages 9 to 11, when physical activity levels drop off. And so the program is an initiative of our Child and Youth Network, which is an organization of 170 different organizations in our city that provide services for youth. And specifically, our role since about 2008, I've been a member since we founded that organization. On the HEPA working group, Healthy Eating, Healthy Physical Activity. And so we've been advisors, study advisors, and for this particular project, we help with recruit, administration, pass distribution, as well as evaluation and integrated knowledge translation. So, so I wanted to talk really about cross-sector collaborations, and this is a really great example of that. So this project came out of the mind of a lot of this collaborators on this group. So there are a lot of partners and different roles. So our service providers are the city and the Y and the Boys and Girls Club. Dissemination through the school boards in Ontario. We have English public, English Catholic, French public, French Catholic. So the 4 school boards, publicly funded school boards. Administration is by the Child and Youth Network, as well as my lab and other professors. And we've actually received some great funding from the Canadian Cancer Society and the Children, CIHR, Canadian Institute of Health Research, and the Children's Health Foundation, etc. And lots of great co-investigators and key trainees. Those trainees are all gone now, but they're all in great places, either working for the city, for planners, for professors, etc. So that's another great thing about this collaboration is often our students who work on these projects end up getting jobs with the organizations. So what did we learn from that? We did an evaluation. We've been doing evaluations every year, but what we got funded for was 2014, 2015. So we had 100 schools participate, which was 99% of all schools. About 1,709 students did fill out all our surveys. What did we learn? There was unfortunately unequal uptake. So it was higher in areas with higher income, but also higher in areas with more recent immigrants. Moderate use, so only 48% of kids at the time were using it, and the best activities were swimming, skating, and the Boys and Girls Club. And some geographic factors, we mapped everything, of course. And I can show you papers if anyone's interested in learning more. I do have some papers on this. So geographic factors, proximity mattered. So proximity to the Boys and Girls Club, proximity to the arenas, and transport. We learned from our focus groups that transportation was a big barrier. The biggest things to the barriers to participation as well as use was active recruitment, information, so knowledge. So when we did this recruiting, we went into 50% of the schools, we just gave them the packages. 50% of the schools, we went in there and we told the kids about the program and how great it was. And those schools where we actually got to tell them, they had an uptake of about 80%. The ones where we didn't tell them had an uptake of about 20, a little bit higher than 20%. And also the same with use. So knowledge, information, accessibility is more than just geography and economics, it's information. So, and then what we learned, the program was successful at increasing physical activity levels. We saw statistically significant increases, especially among the girls, and also changed the trajectories of that. So what have we been doing with this? Well, so far, actually, closer to 20,000 students have participated in the program. We have no more funding, so we kind of run it out of the lab on a volunteer basis. The program is removing barriers. It's filling a need for certain groups, especially girls. This wouldn't have worked without cross-sector collaboration, and student engagement was also a critical factor to success, so being able to actually tell them about it. So what have we been doing since that evaluation? Geospatially targeting promotions. So way back in 2019, my student Emma did a really great job. She probably can't see that, but we looked at hot spots of registration in cold spots. So the areas where kids were from who didn't register for the program or didn't use it. And we went out there and geospatially targeted, and we were able to increase the registrations up by 50%. So, and that was in a COVID year too. So that was pretty fantastic. And we were stopped, we were stopped by COVID, so we would have had even more. Surveys and interview with parents. During COVID, we held a lot of Zoom interviews and focus groups to try to figure out what parents would like to see and what the needs were for their kids when we came out of the pandemic. And so we published some things on that. And now we are in the middle of a project. In fact, I have a grant application due in less than 2 weeks. We are trying to expand it. We are expanding it, whether we get the money or not. We're expanding it to the rural counties around our city. So there's 3 counties and 1 city, and then there's 23 different municipalities within there. Basically, we're trying to take this thing that worked in one big urban center and seeing if we can get it to work in smaller centers, primarily rural areas. So we don't know, there's other barriers like transportation, et cetera, but we're going to be working on that until about 2025. Okay, so the next big thing we work on, and the other thing that's popular with kids, is active school travel and active travel. We know that increased walking is linked to more increased physical activity, decreased overweight and health problems. In the US and Canada, there's been a dramatic decline in active school travel, so active travel to and from school in the past 2 decades. So walking or biking to schools dropped right off. We also know from our geographical studies that the likelihood of walking or biking to school is impacted by the environment, built environment. And this is related to factors such as distance, of course, is the #1 thing, but also safety and quality. So what was our solution? We needed to consider, well, we're pushing the consideration of child health when we open and close schools. And so it's a battle. We need to invest in supportive infrastructure, but also we need to promote school travel planning, change the culture. So, second case study I want to talk about is our school travel planning project. We've been working on this since 2013 with the Active and Safe Routes to School group in our region, Elgin, London, Middlesex, Oxford, St. Thomas. So school travel planning is really encourages active travel to and from school by developing action plans to build on strengths and to work to remove concerns around schools. And this is not only with researchers, but it's with parents, groups, public health nurses, and municipal workers, engineers, et cetera. So this group build an action plan. So the goal is to increase AST, active school travel, by promoting and eventually to promote child health well-being. So what have we been doing? Our relationship with the Child and Youth Network began in not the Child and Youth Network, the Active and Safe Routes to School, ACERTS we call it, in 2005 when I was invited there to join their advisory committee. But ever since, we've been helping with evaluation, integrated knowledge translation, dissemination, and advocacy, writing policy reports, et cetera. And what's really cool, again, a lot of my students have been involved, and the current co-chair is my former postdoc, and before him was my former master's student. So students stay involved. Yeah, so we keep working away on this. And again, wouldn't work without a cross-sector collaboration, many partners. So again, just lots of logos, but the cities, the municipalities, the police forces, some national organizations focused on active travel, the school boards. We do the evaluation at the universities, and our funding has come again from CIHR, Children's Health Foundation, as well as Government of Ontario and national nonprofits aiming that focus on active school travel. Lots of co-investigators at different universities. Our team always, I should also make a point, there's some professor names there, but there's also, we often have a knowledge user, co-investigators. So Kate Berry from Ontario Active School Travel, Green Communities Canada was involved in this one. Other times we have the school board officers, planners, et cetera. And lots of names there, trainees. Hundreds of people have been on it, and some are now professors at other places. It's great. So what did we find? Well, yeah, this is going back to our first stage, our cross-sectional stuff. We had 17 schools involved, 3,300 parent youth surveys, pairs. What did we learn? Well, 42% were walking, 3% were biking to school, 68% would prefer to walk or bike if they had their choice. So we realized that there's an unmet demand there. And so we, again, there's some papers I can share with you, but distance is the #1 thing. Traffic safety, the lack of infrastructure and weather, and the belief that it was just easier to drive. These were the main barriers to walking or biking to school. And though we have discovered through our intervention work, early intervention work, that our follow-up data indicates that there are increased walkers in schools with school travel plans. So we're trying to conduct some more studies on that. We do have a $1 million grant from the Canadian Institutes of Health Research to do a big longitudinal study of school travel planning. So with more schools, more partners, we've been doing a lot more advocacy work with key stakeholders. We've written a few government policy reports that we can share, doing webinars, et cetera, just get the word out. So we're focused on process evaluation, and because of the objective measure bias in funders, we are also trying to use GPS accelerometry and air quality monitors, et cetera, to look at the impacts of our work. We have been stalled by COVID, not being able to get into schools, et cetera. So we've developed an online intervention, and we're testing that to see whether that would an online educational intervention would work. So our ultimate question that we're still trying to figure out, does active school travel lead to increased physical activity, better air quality, et cetera? And, can school travel plans lead to those increased physical activity? So I would say that the best stuff is yet to come on everything. Third and final case study I want to focus on, which is another big issue with children's health and well-being, is food environments, diet, and health. I know some of you in this audience have done work in that area. Great. So we know that poor nutrition is linked to increased rates of obesity and type 2 diabetes and lots of other health issues. Our work has shown in our region, less than a third of kids are eating daily recommended servings of fruit and vegetables, but over 3/4 of them are having a sugary sweet beverage every day. It's not great. Our geographic work, our built environment work has shown that increased junk food outlets near the school is linked to increased junk food purchasing, poor diet quality overall, and increased BMI. There's a map that I've shown many, many times, just showing how also schools that are located in more lower income areas and more distressed areas tend to have more junk food outlets nearby than schools that are in better off areas. So there's certainly an equity issue at play. And so from all this work, what did we decide? What do we need? We need to improve food environments in and around schools. So how have we been doing that? So the final case study is the centrally procured school food program. And some of you might find this interesting, that Canada is the only G7 nation without a national school lunch program, national school. Even the US has one. It's an embarrassment that we don't have this. And so we've been working with the Ontario Student Nutrition Program to come up with this innovative program. And it was really this program that we created a few years ago provided children in 30 elementary schools with healthy, locally sourced fruit and vegetables and supplementary food groups like dairy once per day for 12 weeks. Just that's it. That's all, it's not a lot of money to be able to do this. The purpose of the program is twofold, actually. It was to improve nutritional quality of food being offered through the existing school snack programs, but also it was to establish some local food procurement strategies in order to source a greater proportion of the programmed food from local farmers. So the overarching goal really was to improve child nutrition and really spark those lifelong healthy eating habits, and which we know kind of really tail off by the end of grade school. Yeah, how did we get together? How did we do this? Our relationship with the Ontario Student Nutrition Program began in 2015 when I was invited to serve on their advisory board of the Southwest Region's OSMP. And our role on this project, which ran from 2017 to 2019, involved planning, recruitment of kids at schools and schools, and evaluations and reports and dissemination, et cetera. So what did we learn? Oh, the cross-sector collaboration, lots of partners. And so our OSMP is run by the Victoria Order of Nurses, actually, from the Southwest region, and this other wonderful charity organization called Investing in Children. So with this project, we had school boards and again, universities, and we received funding from different sources. Lots of professors, and again, on the co-investigator on our project was Stephanie Seagate, who was the ED, executive director of that organization at the time, and lots of students who are all off doing wonderful things now. So what did we learn? For this intervention project, we had 60 schools, 30 received the intervention, 30 didn't at the time, they did after the intervention study. We had about 2,443 grade 5 to 8 students, pre and post. So food knowledge, we had a slight increase in food knowledge after the intervention. And dietary intake, we had an increase in dairy, an increase in fruit, but not vegetables after the intervention. For those of you epidemiologists, probably, you know, the nutritional epidemiology is the hardest thing to nail down and figure out. And so maybe we didn't have the right tool, but we also held a lot of child focus groups, in fact, 38 child focus groups, and we did learn that kids were trying new things and reduce their hunger. A lot of kids talking about how these things reduce their hunger. We did interviews with school staff and food providers, farmers and distributors, etc. And they helped identify successes and challenges. And so we published a few process evaluation papers that we'll share with you about that. So it was a success. And so the implications immediately, actually before we even got our results out, the program expanded to 150 schools. It reached over 46,000 students, over 1.5 million surveys, but it's much, much more than that now. I should try to get the updated. It's more across the entire region. Some of the other things we're working on related to this, the Smart Appetite for Youth project. We've created a smartphone intervention to promote healthy eating. You can actually download it from the App Store if you wish, called Smart Appetite. And this is about increasing food knowledge and dietary habits, better improving food purchasing, etc. And you know, we built in what we had learned from our other studies into this app, and we've got a large intervention study with high school students right now. And advocacy, we're in Canada, the Coalition for Healthy School Food and other organizations to improve access to healthy food at school, and working towards that National School Food Program. Gets mentioned every election time, but doesn't quite they don't follow through. We can talk about politicians later, but it's just before lunch, so we probably shouldn't. Part 3, lessons learned. Okay, I think I'm still doing okay on time. For part 3 of my talk, I want to wrap up by discussing some of the lessons learned from doing this work over the years. First of all, community geography is not standing on the sidelines. It's not, you know, standing outside the tank or in the neighborhood and observing the subjects from afar, and every now and then sprinkling in a little intervention and seeing what happens. No. It's about diving right in, right? Sometimes the water will be lukewarm. Sometimes it'll be really cold, icy cold. And sometimes you might get bitten once or twice, right? But other times you meet new friends and it's worth it. Collaborators, connections, and friends. So you got to dive right in. So there are a lot of benefits to this work, and I want to give you my top 7 list. I wanted to do a David Letterman's top 10, but you know, these are so good you only need 7, right? So what are the benefits to the researchers? And I think I'm preaching to the converted here, but first of all, it helps identify worthwhile questions. We're never at a loss for what kind of research to do when you're getting those questions from the community. Engagement improves recruitment and retention. So often the hardest thing to keep people engaged in the study. Well, when the study's for them and with community, it improves. It ensures research is relevant and impactful. So, you know, through integrated knowledge translation, et cetera, again, we work with the community to get those answers right from the beginning. And also a lot of meaningful experiences for students and faculty. You know, sometimes during my grad days, I struggled for trying to realize why I was doing what I was doing, to explaining it to grandma, why it was important for me to do this. But I think when you do the community work and when you get the cross-sector collaboration, you know that your work is going to be used. It's not just going to be published and sitting on a shelf. Opportunities for co-learning and accessing local knowledge. I think this is critical. I've learned more. Sometimes I feel like I've learned more from community organizers than they've learned from me. So it's so amazing to be able to get that lived experience and understand from them. Privileged access to data. When you are partnering with the city, with the community group, with sometimes, you know, data access is so hard to get, but when you're a part of the team, you're able to get access to data. You can answer those bigger, tougher questions. And it also opens up alternative sources of funding. So there's lots of community type grants out there. So what are the benefits for community collaborators? Access to fresh ideas and cheap, for free labor. Students are willing to work for free, often because they get something out of it. They get really great experiences. But also those fresh ideas, there's new perspectives on things. So that's really important for community funders. Access to up-to-date equipment and software. So we have the flashy computers and that often local organizations, the smaller ones, just don't have the budget. They have to spend the money and keeping the lights on and paying the few staff that they have and software as well. And sometimes we can help negotiate free licenses for communities too. We've done that before with Esri Canada, getting a GIS license for the community group for free. Highest and best use of scarce resources. Probably heard that, highest and best use of your time. Again, well, even well-funded public health units were really stretched during the last few years, focusing on something else. Some of you probably heard of. So they should be spending their time on what they're good at. We can spend our time what we're good at. You know, there's no reason for them to learn GIS. We can do the GIS for them. Alternative sources funding for them, right? So now they can tap into academic resources. Co-learning capacity building too. So community groups and organizers and people there can also learn from the academics. It can also enrich outcomes and reporting. So I've helped a lot of smaller nonprofits with their reports to funders or set up an evaluation. In fact, historically, all you had to do, evaluation was a very, very small part of a community grant. 1% of the budget tops, and you way of evaluation is handing out a survey afterwards saying, did you like what you just did? And that would be about it. We're talking to a few people. Well, we can help really enrich those evaluations for their government reports. And now a lot of funders are asking for a more thorough evaluation of whether the program worked or not. And that's where students and professors can come in and help out. The power of PhD and tenure. I say this, the PhDs, all these students with their higher degrees, that get some still. I know we're an anti-intellectual society now, but I think sometimes it really does hold weight, and it can help the community organization lobby for something else from funders and government. And when I say power of tenure, I can say the things that aren't so popular that can get, I'm not going to get in trouble, and where sometimes an community organization can't say what they really want to because they're a little bit more cautious about their position in society. So I think I've often been used to be the doctor so-and-so. I'm not a medical doctor, but I can draw you out to the hospital. But they use my PhD to help make the case for what really needs to happen. So the general challenges, I could put 76 here, honestly, and in the last few years, I put 200. Restrictive data sharing and discouraging policies. There's nothing worse than doing a project for a city, a municipality, but then they won't give you the data that they have to help you actually do the project for them. But they've got it, it's sitting there. It was paid for with taxpayer dollars. And so that frustrates me. This is Jason's frustration list, sorry. Do you have all day? I'll watch the clock. Institutional inertia in politics and inconsistency. Oh, what is it? The 6 worst words that you want to hear is we've always done it this way, or so done it this way. And that we hear that so much. We've always done it this way. This is how we do it. Why? No, we've always done it this way. But you don't have to do it that way. Sometimes there's a better way, but people are stuck in, especially governments. Here I'm talking about governments more than, and universities, institutions, right? And politics about who gets access, who doesn't get access. Oh, and the inconsistency when something changes, the rule changes for who you are, and that's frustrating. Slower decision-making and timing mismatch. This is, academics have this all the time. The community needs it now. They need it now. But the grant that I'm applying for in 2 weeks, I'm not going to hear about it until the summer, and they're not going to start funding until October 1st. We need the answer now. And I'm not going to hear about it until, maybe I won't hear about it in time to recruit that grad student who's going to work on the project that I need to do it. So the timing, it's always really difficult. We need more rapid response grants and rapid turnaround things, but or data dashboards and neighborhood data collection. So we have ongoing, so we always have the baseline ready rather than having to collect it later. Dilemmas of dissemination and what counts. Yeah, so I've got tenure, I'm okay, but we talked about this earlier. You know, the reports for community are really important. They take a long time. But unfortunately for tenure, you typically need those peer reviewed journal articles and large impact factor thing. But you know, that sometimes you create other forms of research products that are incredibly useful to the community, and that should count, right? So we got to rethink about what counts. Funding and cost recovery. Yeah, it's a challenge. I have a lot of staff, as I said, I had over 1,000 people in 20 years, and they're often, I'm paying them to volunteer. And so every now and then I have to get cost recovery for all the time, paid time of my employees that are working in community. So sometimes it's quite difficult. And that can be like one-way relationships also. And that's both ways too, where you know, you'll give, and then, but then let's say they won't give you the data that you need to be able to publish it. So you don't get what counts in your world, or you're taking from the community members and you're not giving them what they need. So that's a real challenge. Volunteer burnout and turnover. Yeah, and especially over the last few years, we've all been really tired, and it's really difficult. And so volunteerism really dropped in my region, and getting people back out to do things. Well, now we have a different, we all want to get back out and help, but we're guarded about that because we've been burnt out, we're tired, and we want to make sure that what you do is really worth it. And turnover, I've joked this morning, I like to call my Heal Lab a terribly inefficient social enterprise consulting firm. And it's terribly inefficient because my job is to lose my best employees. My job is to train grad students to go off and get good jobs, not to keep them. So I'm constantly retraining, but that's part of my job. But it's really hard if you want to, you know, for getting stuff done. And actually turnover also, I would say turnover in with volunteer groups, turnover in staff, that can always, even at cities, stuff. Okay, so some lessons learned. I promised this in my last slide, but I got some 7 lessons learned. Number 1, we need a convincing value proposition for all. So you can't go do community-based research if it's just for you. What's in it for the community? And you really have to spend time thinking about that. Simple research is often invaluable for the community. You know, this presentation didn't have one single scatter plot or regression stats or anything. You don't need that. Sometimes a bar graph or a really simple, clean choropleth map with a few dots, that's what you need, right? And that you may think, oh, this is really basic research. Well, that's the stuff that the community wants to see the most. This is very important in any relationship. Well, communication, but defining scope and expectations early. So when you're engaging with a community group, whether that's an MOU, a memorandum of understanding, a data sharing, or IP agreements, etc. So you don't want to get hurt, right? So think of it as it's not really a prenup, but it's an agreement, a charter. How are we going to work together? And I think that's really important, so that feelings aren't hurt halfway through the process. Seek a variety of funding together. It's, you know, as academics, as I said, you have certain funding. Charities, nonprofits have funding that they can access. Well, you can get together and you have a power team, and it really helps fill those gaps. And I think especially for community organizations, traditionally academics and epidemiologists, public health people have access to way bigger lots of money than community organizations. So you let them know that you can get a bigger chunk of this one if you're part of a bigger team and help out, etc. So I think that's really important to see funding together. Find academic value, but don't rush it. Again, I know it's tough if you're untenured and you're a grad student and your master's and you have to finish in 1 year. So then you make an agreement with the organization about can I publish this, etc. But I would say it was over 5 years before I published my first community-based paper based on my community work. And it was only the community organization, the head of the DIA actually, that said, please publish this. This will help our case. And that paper became one of our most highly cited papers. But you don't rush it. So again, that goes back to the thing I said about smash and grab. Don't do smash and grab research. Spend your time, get together. The academic value will come. Because you have to build the long-term relationships and trust. Again, if I talk to community-based researchers, you all know this. You can't just go in there, take what you want and leave. And it takes time. And hopefully, I think universities are recognizing this, that you need to build relationships, and that takes longer than using a secondary data set that you download from a government website and crank out paper on. So finally, 7, consider a sustainability and exit plan. I think again, it's really tough when you go into a neighborhood, you promise some big activities and you've got all this money and then it runs out, and now you have no money left to even hire people to help you write papers or do that, but you want to keep going. You can't leave people high and dry. Or you can't go teach them GIS and then you leave, and then so you really have to figure that out, because you could end up being with the same organization for 20 years, 30 years, and you've done all you can. So I think it's really good to think about that as a community-based researcher. And I lied, I have one extra one. Number 8, celebrate successes. And I think it's really, really important that you celebrate together, you dine together, you eat food from local restaurants, and when you think about the triple bottom line of people, places, profits, I think we have a quintuple bottom line: people, places, profits, policy change, and partners. And so that's my mantra: 5 Ps, and celebrate those successes. And with that, say thank you very much. It's time for questions. Yes.
I have a question. So in your first case, it's mentioned that after the bridge break, the physical activities level dropped substantially. So, from my very experience, I think that can also really relate with the course load. So I wonder if you or any of you have done any of the education to the community, saying something like, or giving there's evidence like actually physical activity is good for the productivity and can be potentially associated with better grades or something, so as to benefit each other outside the higher course load, is to tackle the time.
Yeah. So I would say that's part of it for sure, but these things have many factors, right? And as I mentioned, for us, accessibility isn't just economic, like giving it free, or geographic, is it there and can you access it? But it's also about information and knowledge, accessibility and knowledge, and that would figure answer your question about knowing that it's still good, and this letting people know that physical activity actually is associated with. There are studies that have shown physical activity is associated with better sleep, and better sleep associated with school performance, etc. Yeah. So and there's other cultural things, sociocultural things about maybe it's not as cool anymore, or maybe you get to a certain stage in a sport, and then all of a sudden you start getting separated into the traveling teams and the really competitive teams versus people who just want to do it socially. So some people quit things because they're not great at soccer. They want to keep playing soccer, but we haven't done any educational campaigns, my lab specifically, in schools of that kind, but we have, there's an amazing organization in Canada called Participation. In fact, actually the scientific officer is going to be on our grant for the next one, where we're trying to get the project to expand into the counties, and they focus on education too. And building it into actually your educational curriculum too. So I'm answering another question now, but our provincial government finally put nutrition on there and food on there, which wasn't in their educational curriculum whereas physical activity was for years.
Thank you so much. That's a great
Thanks.
Thanks, of course. This was a great talk, right there with you. One thing I didn't hear and we didn't talk about this morning was you were talking about sort of data being available from municipal governments and others that taxpayer money is going to. Have you guys gotten yourselves much into the space of who owns the data once it's been collaboratively collected with community? That's certainly something that's very much limited by our data use agreements with administrative data. Challenges we have with our own IRB protections and democratize access to aggregate data as much as we can. But the truth is that if the community is right there with you collecting the data, they want to feel like they own it at the end of the day, because they really do, and we have no symptoms for that. So I'm just wondering what you guys have done in this space.
Yeah, that's a really good point. And I would say that we haven't done a lot. We've talked a lot. So I specifically am not an Indigenous researcher, for example, but we've assisted with Indigenous researcher. And the rules are through the standard is maintain ownership of the data, control over the data, and as well as other ethnocultural communities in our region when collecting data, they own the data and we are having access. We'll help collect it, but that's again in the IP and data sharing agreements.
Is that a good model, maybe? Is that a good model for other disenfranchised communities?
I think so. I think so. And I will say there's one project that we're starting right now that's trying to share data. So again, a lot of the work that we do is individual level data on kids and very sensitive data. So whenever they say, well, open data framework, we want you to post your data attached to your project, we could never do that. We're not allowed to do that. But aggregating data, yes. I was saying we're trying to create a local regional data hub where there's a front facing portal where people can see aggregate data trends over time to see how the region's doing, as well as some generic census data by neighborhood. But then behind the scenes is privileged data that we have an advisory panel. People can share whatever extent they want and then hold it back. And then also the power often comes in linking data, right? So they would still be able to link the public data with their privileged data. But I think that's a great point and something that we need to work on. And I think then who stores the data? Sometimes the issue is, well, if you have a smaller community, they may not have I have $100,000 server with a backup that the data could be there. So there's all there. It needs to be figured out properly.
Yeah, I mean, we've been just doing workarounds and you can request data and the level that you're allowed to see, we'll work with you on, maybe we'll help you analyze it, and that's all you really want. But they're workarounds because because otherwise it feels extractive.
Yeah, exactly. Yeah, in Canada, there are standards for Indigenous research, but there aren't standards for a lot of the other stuff. You're right. And I think building it in and often with less sensitive projects, we would let's say if we were working with the municipal government, we always put in there, we reserve the right to be able to use this for academic nonprofit purposes, like never for profit, but for nonprofit, but only in aggregated and according to RD, et cetera. Yeah. So different in every country too. I've learned that what certain other countries can get away with, that I would never think of doing that.
We do have a question in the chat that I can
Yes.
read out. So this is from Ana Ortegoza. She says, thank you for this very interesting presentation. I have a question here. Has some of this work on transportation to school helped to create or at least put in the government agenda the issue of implementing safety routes to school? There have been some interesting experiences in South America funded by Urban 95 on this, and wondered if you had the same experience. Thank you.
Mm-hmm. Yeah, so yes and no. Safety routes. We have done little projects like Ride to 5. So park, parents park and then at a certain area 5 minutes away, and then have a safe route from walking from there to the school. And there have been other minor things, but nothing really in the municipal policy or the provincial policy, to my knowledge, like that has come out of our work and that exists. I'm going to get flack for this now from my staff that are going to say, well, yes, there's the program in Ottawa does this. So I can't come up with anything right now. I can tell you that we just finished a large policy report. We looked at all policies at the provincial and municipal and school board level to look at issues, and safety was one of those factors. I could distribute a link somehow, or you go to the HEAL website, heal.ca, theheal.ca, and you'll find it.
Oh, yes, and sorry, there's another comment in the chat. Yeah, if anyone on Zoom, you can put questions in the chat, but you also feel free to unmute and be a voice from above to ask a question.
Thank you. Can you hear me?
Yes, we're able to hear you.
Yeah, first of all, thanks for the presentation. It was so helpful. I'm just a little bit interested in the future. And I wanted to ask that, how do you predict the future in this field? Actually the relationship in human geography and even the environment and health issues. And you just told about the lesson that we have learned, but I just want to know about the potentials of this topic and actually this research topic for the future. And even would it be helpful to just focusing more on that? And what are the topics that you may think that it would be helpful to be just investigated more?
Okay. I think that's a very big question with 7 hours of I mean, and I didn't get there. You broke up at certain times, but what are the topics that you think need to be invested more and related? You know, I would think that, well, first of all, climate change. I mean, this is something that I avoided studying early in my years because I didn't think I could make a difference because it was too big, it was too wicked for me. But then I realized, well, after school travel, that's climate change, that's climate related, that's post-carbon cities, that's potentially improving impacts, getting out of the car, riding a bike. So breaking these things down into digestible chunks and realizing that you can make a difference in little bits. So climate change is a big issue. Obviously, we over the last few years, we've realized how increasingly we knew our cities were inequitable, and we knew about the structures, racist structures and inequities in our society. But COVID brought out our I think, I'm not sure that south of the border thought, but I think it just crystallized the problems that access to resources and stable employment and all these kind of things. So I think if I was a student now, I'd be wanting to study the long-term impact of what we went through in the last few years, and also building resilience. So I guess there's I could go on for hours, but resilient cities and resilience would be a big thing from not just health, but economic resilience, because if you don't have a job, that could deeply affect your health too. Yeah, I think, oh, you've already got the question, but I think, I don't know if that's enough there, but.
Thanks, Justin. A couple of times you made a point that girls the impact on girls were much larger than on boys. Is that really a fact that boys are already more actively engaged, or that more active in their daily lives, or that girls are more involved in the programs? I saw your picture with the Youth Advisory Council and the only 3 boys and many girls. So do you have particular challenge engaging boys in these programs, and what are you doing about it?
Okay, so you're bang on. One of the things we saw that there was a bigger impact on girls was because boys were already incredibly physically active. And the group of boys that we were able to collect data on too, because there's always a bias in the samples of there. But why it really worked for girls was the social connectedness angle. And I forgot to mention, this was free pass +1. So you could take a friend. So it was a free activity plus, could be a parent, but it could be a friend. And so what we learned from the focus groups is that girls really loved doing these activities with other girls. So they got together and they made it was social activity and they were feeling included, etc. And so I think that was the big thing that worked with that, why we saw girls more of a difference. The fact that boys were already active and girls. And then the Youth Advisory Council, yes, we always have lots and lots of girls. And again, that's something about our culture that well, we can go on and on about that, about how we treat our girls versus boys now and in high school, but also how it's not cool for boys don't think it's cool to be smart and be a joiners, etc. So cultural shifts are probably needed to get more engaged.
So I think it's always a
Sorry.
good sign that we can have more conversation than fits in the time. And I saw a lot of thanks also in the chat. So I just want to ask you to join me in thanking Jason.